Good afternoon, everyone. Welcome to this historic day at Billings Clinic and for everyone we serve. I'd like to introduce Dr. Scott Elner, our CEO for Billings Clinic. Scott?
Today is a great day for the community of Billings and for Billings Clinic. I'm so proud of the work that's gone into getting the allocation of vaccine, the COVID-19 vaccine, over the last several months. We have had a fantastic team of pharmacists, pharmacy techs, physicians, nurses, security, facilities planning, who have worked tirelessly for us to get the vaccine in really record time. And so I am feeling so blessed and optimistic that in the next few months, as we distribute the vaccine to our healthcare workforce, we're going to see a light coming out of this fog and continue to give care like we always have in an environment where people feel safe. They feel like we're getting beyond the year of 2020, which has been challenging. And we can continue to provide the exceptional care that we are known to provide in a way where there's just a little bit less challenge for all of our patients and for our healthcare workforce. The people here today are true heroes. They're on the front line. They have been exposed to patients with aerosolization of particles of COVID-19. And we want to make sure that they're in the first line to get the vaccine. So it's a great day, and we thank you all for being here. I'm going to have Dr. Tony Green-Cheatwood, the CMO for Billings Clinic, talk about some of the logistics that went into the planning for today. Thank you.
Thank you, Scott. My name is Tony Green-Cheatwood. I'm the Chief Medical Officer here at Billings Clinic. And the team of individuals that Scott alluded to has been working for weeks as soon as we learned that Pfizer had submitted the documentation for their EUA so that we could provide the vaccine to our community and our caregivers as soon as possible and as soon as it was available. Surprisingly, we actually received it earlier than anticipated, so we're able to do this initial vaccination with our first 5. These individuals represent the various elements of the healthcare system that have been touched by COVID. We have pharmacy, we have paramedic, respiratory therapy, nursing in the medical floor, a physician in the intensive care unit, and our EVS. Each one of these individuals has touched and taken care of a COVID patient in one way or another, so we really wanted to honor them and their service today. As we prepare to inject their vaccines, they've all volunteered to be here today with you all and be the first to receive it here, not only at Billings Clinic, but in Billings. We're very proud of our healthcare workers and the service they've provided relentlessly without pause over the last several months. And knowing there's a light at the end of the tunnel of this pandemic gives us all amazing hope. And I've lost my sound. Oh, there it is. There it is back. And now I'm going to keep talking because we've got 2 more to draw up. Our plans here at Billings Clinic for distribution of the vaccine for our associates and those who work here will kick off on Thursday. And now we are ready, it appears. So, as with any vaccine, we will swab the arm first with alcohol. And ready, get set, vaccinate.
That was fast.
It was fast, right? Harmless, just everyone get vaccinated when you can. I would entertain any questions if there are any from those of you who've been able to attend today. Yes, sir.
This is 5 of the vaccinations. There were about 975, right? That came in?
Exactly 975, yes.
Where are the rest going?
They'll be going to those who work at Billings Clinic, and well as our first responders from the Billings Fire Department. We'll start that process on Thursday. Tomorrow we have a small group that we vaccinated to make sure our processes are in place with no opportunity for error, with safety being on the forefront. And Thursday we'll launch our vaccination clinics for starting with those individuals such as these 5 who are seeing COVID patients in the hospital. Once we go through those first 975, the state is on an allocation schedule, and we'll be able to continue those vaccinations, not only with Billings Clinic, with also the family medicine residency from Riverstone, from our anesthesia partners, and continue to expand that to the community as soon as we have enough allocation available.
How about the critical access hospitals in the region?
The critical access hospitals in the region, a lot of them are unable to store the Pfizer vaccine with the ultra cold storage. Moderna is another vaccine that will be discussed this week for their EUA. Assuming they get approved, those vaccinations not requiring that storage requirement will be distributed to the critical access hospitals, both our system partners as well as throughout the state, to allow for continued vaccination of those first care responders wherever they may live in Montana. Yes?
Will patients know if their doctors are vaccinated?
Whether someone receives a vaccine or not would be a HIPAA issue. The provider can share that information, but we would not broadcast it.
And will the COVID-19 vaccine be mandatory for staff?
The COVID-19 vaccine is not mandatory for staff. You actually cannot mandate something under an EUA, so we couldn't even if we wanted to at this point. Thank you.
You mentioned this was the Pfizer vaccine, right?
Yes.
Any particular differences that people should know about Pfizer vaccine versus the other one that you mentioned?
Sure. Surprisingly, the efficacy has been very similar. Really, the big difference is the storage. So not something that really pertains to the average person. They both are 2-dose vaccines, so they require a second dose. So in 21 days, they'll all be back for their second shot. There is a vaccine under trial now that is a single dose, but that isn't ready for its EUA yet.
Some people confuse a vaccine with a cure. Can you explain the difference between the two?
Sure. A vaccine helps prevent a disease. A cure means we eradicate it. So if you look at things like smallpox, for example, we've had a vaccine forever, not ever, but many years. So in essence, you think it's cured. However, we do see it show up once in a while, so it can be confusing, but a vaccine prevents the disease from occurring. A cure means we have killed it completely, and that's not what the vaccine is geared for.
Could you maybe take me through Vaccine for Dummies? How does this vaccine help fight coronavirus?
Sure. So the vaccine actually triggers your body to identify that as a foreign thing and to build up your own immune response. And that's part of the importance of the second shot, to kind of superinforce that with your cells, if you will, that it knows to fight that. So if you do get exposed to the virus later, your body has built up its ability to fight it. All right, well, thank you all for being here today. I really appreciate it. And thank you all for volunteering to start us off.